fact, now we are still in the reproductive month, and Sub-Saharan Africa has the highest adolescent birth rate in the world, with 99 births per 1,000 young women aged between 15 and 19 years, more than double the global average of 44 per 1,000. Now, early pregnancy often leads to severe health risks as well as long-term socio-economic disadvantages for women in particular. Furthermore, 17% of all women in Sub-Saharan Africa and 23% of married or in-union women have an unmet need for family planning, leaving millions vulnerable to unplanned pregnancies. Well, to further unpack this, let's now welcome Ms. Pontsho Pilane, Communications and Advocacy Manager at the Soul City Institute. Pontsho, great to have you with us. A very good afternoon. So these figures in my intro should be quite alarming and a cause for concern for the greater region. But for better context and understanding, what factors have presented us with these unfortunate circumstances?
Thank you so much, Alicia, and good afternoon to your viewers. I think one of the things that we really need to focus on when we're hearing these harrowing figures is the fact that reproductive health and justice is a reality that many women and gender diverse people still do not have. And this is why during Reproductive Health Month at Soul City Institute, we decided to really focus on these alarming rates and why it's important for reproductive justice, health, and services to be exercised by everyone, anyone who wants to access these services should be able to, regardless of their social standing or class or race or any other factors that could mitigate their access.
Absolutely. While we're on this point, Pontsho, of the multiple options that women might or do have, the issue of self-managed abortions versus the back route or even unsafe abortions are also quite a factor, with South Africa currently having only about 7% of government facilities able to perform these free services. But the debate here, Pontsho, is that the safer options are often met or fraught with multiple steps and also present to be very expensive. And also the need to afford these women this option is often met with cultural resistance and even stigma in some cases, especially outside of our immediate borders.
Exactly. I think when we think about unsafe abortion, I often say people must think about unsafe abortion as a major contributor to maternal mortality rate more than anything else. Because when we look at the statistics, research shows us that about 5.2 to 17.2% of maternal deaths that are happening annually in Sub-Saharan Africa are because of unsafe abortion procedures. So this is not something we should take lightly. But on top of that, even though South Africa has such a liberal abortion law and we have such a comprehensive act, the Choice of Termination of Pregnancy Act, we know factors such as being in a rural area, the stigma, as you've mentioned, and other factors that really stand in the way of women and gender diverse people accessing safe abortion services. These are some of the things that Reproductive Health Month and commemorating Reproductive Health Month are about. What does it take? What do we need to do as a country, as a society? Because it doesn't only rest on the Department of Health. Are we as a society enabling factors that enable a person who finds themselves pregnant to go to their local clinic? Or would we be the nurse or the next door neighbor who hears what they're there for and spread and stigmatize them and spread rumors across the community? So this is not only an indictment on health facilities, but it's also a really indictment on us as communities and society to ensure that reproductive health and especially abortion access is accessible to all.
With so many having this access, particularly to family planning, Pontsho, then what do these revelations, though, lay bare and expose in the long-term future of the need to prioritize reproductive health as well as challenges that women are currently facing in the sub-region? We know that some countries where women are still largely dominated, I don't want to say oppressed, by their male counterparts into forced marriages, child brides. This is still persistent behaviors. We know just off the hand, China just last year was reportedly urging women, on the contrary, to have more babies due to the dwindling birth rates because of their previous policies. So this actually highlights the need that we really need to shine a special focus into family planning across the region.
Exactly, Alicia. And I think one thing we need to think about when we think about family planning, contraception, abortion, or all reproductive health services as a whole is that they're an enabler of gender equity. We cannot have proper gender equity when reproductive health rights and health is not realized in South Africa. So what I'm talking about really making progress where young women, girls, and gender diverse people have an access to healthcare, have the support and the resources they require to live thriving lives in the future. And we need to understand that there is no separating reproductive health from the broader aspects of gender equality. And as Soul City, you know, we think back to our 30-year legacy and how at the core of the work that we do has really been centering women, centering the experiences of women, and ensuring that women are able to live thriving lives. And when we have these challenges that are in the way, this really prohibits women from really exercising their own freedoms, feeling liberated, but also feeling justified in the actions that they take, where they are not just victims of circumstances, but they're able to really exercise their bodily autonomy and make decisions about their lives, about their bodies that make sense for them and the communities they come from.
Pontsho, thank you so much for that enlightening discussion there. Pontsho Pilane is Soul City Institute on Sub-Saharan Africa facing high adolescent birth rates, leading to a wide range of disadvantages, particularly for those women.